Dr. Josephitis, and I'd like to discuss a common concern of patients that are wanting to undergo hair transplant surgery. How painful is it? It's actually not that painful at all. Many patients have prior experiences of being at the dentist and having injections and shots and being a very uncomfortable experience. Others have had no experience whatsoever and really just don't know what it's about. Well, I can tell you firsthand, it's a very comfortable experience. First of all, it's an elective procedure, so you don't have to do it. So we want you to be as comfortable as possible. Over the years, you might want to come back for a second procedure. We certainly don't want you to have bad memories about the procedure. So let me tell you a little bit about it and give you firsthand. Well, in the morning when you come in, one of the biggest concerns for patients is the unknown, what to expect. So one of the first things we do in the morning is we sit you down in my office. We spend a good half an hour to an hour discussing your plan. We go over step by step what you are to experience. That's one of the first things that really helps to reassure you and give you that level of comfort that you want. Once we're ready, we go to the surgical room. We like to have big, open, airy surgical rooms. We have a very comfortable chair for you to sit in. The patient has access to music, so we have patients can listen to music if they like. Also, we have hundreds of movies, so you can, throughout the day, watch movies. We have patients that go through 3-4 movies or a whole series of comedies that they like. So it's up to you. To be honest, actually, about 50% of patients at some point during the day are sleeping. If you can believe it or not, they spend most of the day sleeping the day away, which is a great thing. So how do they get to that point? I mean, there's got to be pain to surgery, right? Well, not really. The first thing we do in the morning when we check you in, we check your blood pressure and vitals. We give you an oral sedative. So if you've ever had a procedure before in the past, you may be familiar, we give you Valium, taken by mouth. It helps to relax you. After that, we will go and do a local anesthetic, kind of like the dentist where they inject. We'll do a local anesthetic around the whole scalp, so you'll be completely numb there. Now, is there going to be pain? Well, there'll be a slight pinch when we first start. We actually use vibration and massage to help reduce this. So if anything, at the worst, it's just a moment or two of a little pinch. After the injections, the scalp is completely numb throughout the whole day, which is great. You don't feel anything on top. It's basically just a long day, and that's why we have those movies and videos and things for you to take a look at. Now, throughout the day, we also want you to be able to get up and be comfortable. So we have lunch break, we have restroom breaks, you can get up and stretch. At any moment during the day, if you'd like, you can get up and take a break. So you're definitely not a prisoner, and we want to make sure it's a nice experience for you. So that's pretty much the day in a nutshell. I actually did a small survey of patients of mine over a number of years just to ask them, how painful do you think the procedure was? We rated it on a scale of 0 to 10, 10 being the worst pain ever, 0 being nothing. And out of 50 patients that we had surveyed, they gave it a 1.5, so it's actually quite small. Another interesting fun fact that I always tell my patients, especially the ones that are very nervous in the morning, I tell them every single patient that was nervous in the morning, at the end of the day, they tell me, "Doc, I don't know what I was nervous about. It was a piece of cake. It was a walk in the park." So it's always fun to see those same patients at the end of the day say that thing to me as well.